Just very briefly, I just want to say a few words about what we do at Community Health Charities, and then more importantly, get the case study up here so you can hear from our friends at American Express what we've done partnering with them. Community Health Charities for over 50 years now have done really one essentially basic, our mission is to connect those donors in the workplace, those individuals, as Derek really talked about, with the nation's most trusted, credible, respected health charities, whether they're large or small. You know, most of our members, they're household names across the country. The important thing you need to know, whether it's a St. Jude or whether it's an American Cancer, whether it's Be the Match, which you'll see later throughout this conference, is that they're community-based. They're where your employees live. We're, more than workplace giving. I think you're going to hear that from all of the other CEOs today because we have to. As I said earlier, and Peter said, and I think it's evident from Derek's presentation, things have changed, and we've had to change as a result as well. So what we want to do is partner with your corporations, with your companies, and basically we want to do one thing. We want to fill a gap. We know you've got an insurance program. We know you've got a wellness program. We work with those programs, an EAP program, but essentially what we do is fill the gap. What we can do and do exclusively is connect your individual employee in their community with the cause or organization they care about the most, and not just when they want to give, but when they have the diagnosis of their parent with Alzheimer's, when a child has been diagnosed with autism, when there's a substance abuse problem, when there's a depression problem. We know the support groups, we know the education program. Our job is to connect that employee in the privacy of their own homes with that cause at the time that they need them. We do it through a portal. It's called Health Matters at Work. It's our main product. I'm going to bring up Allison Gormley from our Hartford office, who is going to talk to you a little bit about Health Matters at Work and then show you what we've done working with American Express. Allison?
Health Matters at Work, I know many of you do partner with us in giving and volunteerism, but to really fully partner with us really means connecting your employees with those health resources and the Health Matters at Work program. So some of you may be aware of this program because you utilize it, and some of you may not. So I'm gonna take just another minute or two to talk about that, and then I'm gonna introduce or turn it over to Maureen McCluskey from the Healthy Livings Department at American Express that can share with you the impact that they've seen with utilizing our program and the difference that it's made for their employees there. So businesses typically have a heavy focus on have a heavy focus on chronic disease prevention. And businesses do this because 3 out of 4 employees have at least one chronic condition. So if you stop and think about that, 75% of employees in your workplace are struggling with at least one chronic condition. And that really puts a strain on the bottom line. And we'll talk a second about why that puts a strain on the bottom line, but I'm sure everyone here kind of knows the impact that it has. But is your company really seeing the full picture? You might be focused on the employee, but if you imagine the networks that your employee has, it goes beyond just that employee and their chronic condition. When employees or someone in their network is either diagnosed or dies from a chronic condition, their entire network is impacted. So it might not be them, it might be a friend, it might be a relative. If they've been diagnosed, even though that employee may be the 1 in 4 that doesn't have a condition, they're impacted as well. So, and it's happening every day at your business. When you take a look at that network of employees, it's happening. They're impacted. People are dealing with that health crisis. So if it's happening every day at your business, it's having an impact on your bottom line. Employees aren't as productive when they're not well. They're not as productive when they are distracted, thinking about that friend or that loved one who has been diagnosed or has experienced a loss. So what can we do as an organization to bring them along and give them the care and support that they need? We'll talk about that in a minute. So all that to say that in an hour's time, you can see the toll that chronic conditions, and these are just a few of the most common ones that we see, we can see the toll that it's having on people every day. These are people at your companies. It's impacting them every day. So we know that in an hour's time, these things are happening to people. So days, hours, minutes, and seconds, they all matter to your workplace. And what happens off the clock often has an impact of what happens or doesn't happen on the clock. So if we go back to that network and include the 6 in 10 employees that are caregivers for someone with a chronic condition, you can see the even larger issue that chronic disease and health conditions is having on your workplace. This could be you. This could be the person that sits next to you. This could be someone on your team. This could be someone who leads your team. We experience that at Community Health Charities, and we see the impact and concern that we also have for our coworkers as well. So one feeling that's common with employees is that, or caregivers as well, is that they have that feeling that they're alone. Nobody can possibly understand what they're going through and what they're experiencing at that time. So this means that employees continue to be distracted and not performing at their peak performance. So if they're not being productive, they're obviously not getting as much done as they need to be getting done or performing at the level that they're accustomed to performing. Because these situations are highly sensitive, sometimes employees don't feel that they can reach out to their insurance provider or their EAP, or they feel that maybe Big Brother's watching, so they might not be so likely to go there. And those employees that do use those programs sometimes don't find what they're looking for. And that's where Community Health Charities comes in. Tom talked a moment ago about filling the gap that we fill with these other great programs like EAP programs and the programs and services that you get through your insurance provider. We're making those personal connections, those private connections for employees. And through our Health Matters at Work, it's a no-cost program. We don't charge for it. By including us in your workplace giving campaign or partnering with us, we really want to make sure that your employees are getting that connection, not only for people that don't work in your community, but also for people who do work at your company. Let's make those connections so that they can utilize the resources in any of their chronic health crisis that they may experience. So we talked about why, leveraging this program at work, and maybe employees don't feel comfortable because Big Brother's watching. What's the difference with our program? Our program is it's a private program. We don't collect data. It's a health portal that employees can access at any time. If you welcome them to do it at work, they can access it at work, but they can take it home and they can view it privately with their loved ones and at a time that's convenient for them. We're not collecting health information, we're just making that connection. They can find credible information. Not always great doing a Google search with health information. If you've all done it, you have 42 chronic conditions when you go on and do your own Google search. But this is information and research from the nation's most trusted health charities. They know what they're talking about. They fund lots of research. They know a lot about these conditions, and they leverage their knowledge to help educate people, but also to give people those resources that they need. So businesses using Health Matters at Work can utilize a lot of and connect their employees to a lot of great information. Local support groups, peer-to-peer support groups, exercise and rehabilitation services, financial assistance. Sometimes when you're faced with a diagnosis of a very costly condition, sometimes it goes beyond what your insurance may cover. Many of our member charities do offer some level of financial service and assistance. Credible health information and websites and apps that people can use to help them manage those conditions. Monthly patient education webinars. There's a lot to the Health Matters at Work program, so we encourage everybody to take a look at that. So adding Health Matters at Work to an existing health activity or program is easy. It's not meant to replace anything. It's meant to, again, fill that gap of making those personal community and local connections for people when they need it. And businesses like American Express and many other businesses have seen the benefit that these powerful connections that our member charities offer and the way Community Health Charities is able to package and leverage that, they see the difference that it has for their employees. So if this is something you leave to your wellness department at your company, I encourage you to think today about what role you play in making these connections for your employees, making that connection from us to your wellness folks to really leverage these connections and these resources to impact your internal community, your employee community. Maureen is going to talk to us. Maureen McCluskey is here from the Healthy Livings Department at American Express. Her bio is on page 22. I will let everybody review that, but she's a pretty amazing lady. She's been wonderful to work with, and she's got a whole lot of experience doing this. So it's nice to be able to have Maureen come and share what she's doing at American Express and how even with a well-established program at American Express, they were still able to leverage the programs and resources that we have. So over to you, Maureen.
Thank you, Allison. I'm happy to be here today. I always like to talk about our healthy living programs at American Express. We're very proud of them. So if you just click to my next slide. This is American Express. We just celebrated our 164th birthday. It's one of the largest financial service companies in the world. There are over 60,000 employees globally and about 20,000 in the United States. At American Express, our Healthy Living is our brand for our health and wellness program. It's very important to us that we create a culture of health for our people when they come to work and that we walk the talk. We want people to know their numbers. We want people to be engaged in their education. We want people to take action. And those are the ways that we can start to create this culture of health. We have many internal resources for our people, but we're also always looking for external partners. American Express Healthy Living Condition Management Program. What I'm going to talk about today is 1, 2, 3. Why do we do what we do? How do we do what we do? And are we successful at doing what we're doing? So let me start with why do we do what we do? Allison talked about numbers with chronic disease. I think our numbers are no different. 65 of American Express employees report that they have at least one chronic condition on our wellness questionnaire. Chronic conditions account for a majority of the healthcare costs in this country. And also for the employer, it's the productivity costs that really exceed the direct healthcare costs. And I think that makes sense. When employees don't feel well, they're not as productive. They're distracted by other things in their life. So it's the 1-2 punch for the employer. Why aren't employees getting condition management information someplace else? What are the barriers? Well, when you go to your practitioner's office, there's many times a time limit. They have to get you in, they have to get you out. How much time can be spent teaching you the nuances of managing your condition? Also, there may be a lack of health educators within your doctor's office, depending on who you see and how they see. Certainly, there's a time element for employees always. Many times there might be other services, but maybe they're not reimbursed through certain insurance policies. So we looked at all these barriers and we said, how can we help our employees at American Express get over the chronic barriers to manage their conditions? How do we do it? We put condition management, health education in the middle. Internally, we have a lot of great resources. We have a health risk appraisal. We have on-site wellness centers. We have nurses, nurse practitioners, physicians in some locations on site. We have fitness centers in some locations. We have health coaches. We have dietitians. We have Healthy Minds, which is our employee assistance condition. So internally, we have a lot of wonderful resources. Externally, we're always looking for quality partners. So when they come along, we welcome them aboard, because what we really want to do is integrate and sustain all of these resources through a partnership. So we were very happy to add Community Health Charities to our wheel to help us do what we do. Okay, next slide. Okay, collaborating for impact with Community Health Charities. What were we looking for from this external partner? We needed to identify credible, cost-effective resources for our employees. And that was something Community Health Charities was able to bring to the table, because they work with the folks that are really doing the research, that are writing the clinical guidelines on this. So when we come to them with a condition that we want to educate our employees on, they come back to us with some wonderful resources that are available through their member organizations, and they help us target conditions, and they do this at no cost. We needed to tailor the resources to fit our organization and culture. We have a big virtual employee population, so there's not, how do we reach people that don't have on-site wellness centers? And we were able to use their webinars, their podcasts, their newsletters, their websites to get this information out. We need to use resources that educate, engage, and empower our employees. And this is really the strategy for our condition management program. How do we engage our employees? How do we educate them? How do we empower them to make the change? An example of this is our Healthy Living with Asthma program that we launched last year. The prevalence of asthma in this country is going up, particularly in children. So we really had an opportunity here, not only to impact employees, but employee family. It's always a challenge in the workplace to say, okay, maybe your employee is a captive, but as Allison said, our employees go home to families, and asthma impacts both. So in July 2013, we launched Healthy Living with Asthma, and also we launched Healthy Living with Asthma for Kids, which parents of asthmatics could sign up for. We had over 100 employees sign up for this program. About half were adults, and about half were adults with children. We did do some post-surveys on them, and 91% of those responded said that they made a change based on this program. Now, the program lasted approximately 3 months. We found that people identified triggers for asthma that they didn't know they had. They were taking their prescribed medications. They saw their doctor. They reported taking new medications and creating an asthma action plan. These are all things that will keep employees feeling better, being at work, out of the emergency room, and living a better quality of life. Next slide. So these are some of the things, again, that we know that we're being successful. And these were really simple interventions that we brought to our employees in the workplace with low or no cost resources that really impact not only the quality of their life, but the quality of their work, and also can reduce some healthcare costs. Before the program, I'll say after the program, more people showed that they had an asthma treatment plan. When we asked if they had missed work after the program, less people in the last 4 weeks had missed a day related to their asthma. This is very important, not only for employees, but for employers. We also, here's the trigger slide, we found that they did have a written plan, and they learned to use some very simple tools that many times physicians feel that maybe they believe their patients know how to use, but these were simple tools that we were able to provide some education on that really impacted the treatment of asthma. We're looking forward to launching our second asthma program this spring. We hear that Community Health Charities has some wonderful new resources for us, and what we'll do is we'll update our program, we'll integrate these new resources into the program, and we'll be able to reach more people with more quality tools that are continually being developed.